While sometimes it's easier to use an ultrasonic scaler to perform your dental cleanings, it's very important that you familiarize yourself with manual instruments. Maybe you'll work in a practice where you do not have an ultrasonic scaler, or perhaps there's a area in the mouth or some calculus in a specific area where the ultrasonic tip won't allow you to get into the space that you need, so you'll use a manual instrument. Okay, so now we've opened up our dental instrument pack, and the first thing you'll see is a dental mirror. The dental mirror is just used for any additional visualization you need in maybe a dark area of the mouth or an area that's hard to see and to reach. This will give you some additional visualization with that. In addition to that, we're going to want you to use the blunt end of this instrument to check for mobility of the teeth. Many of our other instruments are double-sided. So since this is a pretty sturdy one-sided instrument, we're going to ask that you simply check the mobility of the teeth using this to see how much a tooth moves. So you'll just kind of go down the line, seeing if there's any mobility with slight pressure to this blunt end of this instrument. Okay, the next instrument in your dental pack is going to be the subgingival curette, and this is exactly what the name implies, is that it is used for subgingival spaces. It is easy to find which instrument is a subgingival curette in your instrument packs because it, in addition to the instrument color pack, which this one happens to be white, also is labeled with a pink band. So all subgingival curettes are labeled with a pink band. So this is a very delicate instrument. It is not to be used on the crown surface, only the subgingival surface of the teeth. They're double-sided, and there are one cutting edge on each end of the instrument. So right there in the center is the cutting edge. The cutting edge is very narrow and delicate so that it can easily slip into those sulci areas for scaling of that tooth surface. You'll be able to find that cutting edge if you practice using them drawing down on your finger. And again, use only for the subgingival space. So with the one cutting edge, we'll find what angle works best using appropriate technique and pull down on that tooth. Now in animals that have a healthy mouth and minimal damage to the gum, we're not going to have a lot of space for us to use this instrument. But in animals with significant periodontal disease, we may be more likely to use this because we're going to have more of those sulci areas that we can fit this instrument down into. So it's double-sided so that you can see, depending on where you're at in the mouth, which angle works best or which end works best, and you'll use this to scale subgingival surfaces of the teeth. The next instrument that we're going to use is called the claw scaler, and that is because it simply looks like a claw. So depending on which ones you have, and you may have both in your instrument packs, they could be double-sided or single-sided. We have a few different options here. Some are getting a little bit duller than others, so pick one that works well. So what's important to know about these is that they are used on the crown surface only of the teeth, and there are two cutting edges on either side of the end. So the cutting sides are on each side of each edge. And again, you'll start at the top of the gum line, scaling down the tooth, and use this on your finger so that you can find where that cutting edge is, because if you're scaling a tooth not on the cutting edge, you're not going to get very far. So again, this is the claw scaler with two cutting edges on either end of the double-sided instrument, and there might be a few different variations. So on our model here, we're going to scale. Now, also important to know about this instrument is you will never use the tip of this instrument. So I never want to see you using the tip of this for any reason, whether it's to check for mobility or to get into a crevice or a space. Never. Just use the two cutting edges. So we're not going to get subgingival with this. We're going to stay on that crown surface only, find our cutting edge, and pull gently down the tooth away from the gum line. All right, the next set of instruments that you will probably have in your pack are instruments called jaquettes. So make sure you know how to spell and pronounce that word, jaquette. So there are many different variations, but they all serve the same purpose. They are going to be used, again, for the crown only. We are not going to use this on the subgingival space areas of our teeth, or of the animal's teeth, only on the crown surface. So these have a neck and a head that also have two cutting edges, similar to the claw. So again, use your fingertips. You can find where that cutting edge is and appreciate where to place that when you scale your patient's teeth. So there's 2 cutting edges on either side on the ends of on the head of our instruments, as well as a spine along the back. Same thing as the claw that I did not mention earlier. I'll show you really quick. Again, 2 cutting edges on either side of the claw with a spine down the back, which is not where the cutting edge is located. So again, with Jaquette, something else to notice about this is that notice that the neck and the head are nearly perpendicular to one another. Right there. So notice that that neck and that head are nearly perpendicular with one another, no matter in which ones that I grab. So that's something that you're going to want to remember when you're identifying these instruments. And again, 2 cutting edges for the crown only. So depending on the space or the tooth that you're trying to scale, you'll pick the appropriate angle or the appropriate Jaquette that you feel most comfortable with. And you're going to scale moving down the tooth away from that gum line. This one actually is more appropriate. All right, finishing up with the instruments. The next one to talk about is the spade scaler. This one is an easy one to remember. It looks like a spade. So on the end here, there's 1 cutting edge, and that cutting edge is right on the very edge of this instrument, right there. So you're not going to use the sides of this instrument. Those are not the cutting edge. The cutting edge is right on the side. And so if I were a tooth, you would be moving down away from the gum line in this fashion. So you'll find that cutting edge on your hand. Some of these are a little bit dull, so you may find that you're kind of having to hold that instrument in a different angle to find that cutting edge. This is for the crown use only. And again, moving away from that gum, finding that cutting edge, scraping towards the apical root, away from that gum line, with a good amount of pressure, but not too much. And finishing up, last but not least, we have the periodontal probe. So the periodontal probe is going to be used to find different pockets or carious lesions. So you're going to use them on this very, very delicate tip. This tip is strictly just a tip. So if you're looking for any indentation, any pockets, any divots, you'll just poke. But this is not to be used for any type of cleaning purpose because it's so delicate. And on the other side is the periodontal probe with the tick marks indicating any pockets. So remembering from lecture, we are going to use this to measure our sulci depth, which is going to be more significant in patients that have periodontal disease. And those tick marks are going to be 9 millimeters, 5 millimeters, and 3 millimeters. So 9 millimeters at our farthest tick, 5, and 3. Remember that for cats, it's normal to have a pocket of, oops, there we go, 0 to 1 millimeter in cats and 0 to 3 millimeters in dogs. And for this, you're going to just walk around the entire tooth and look for any dropping of the periodontal probe. So this is a very delicate instrument. Don't ever use this in a very harsh way. So we're just going to kind of walk along that tooth up in the subgingival area and kind of on each quadrant looking to see where those excuse me, where that periodontal probe drops in. So if I were measuring, let's say this canine, it actually drops to 5, so it'd be 5, walk along, drops to 5, walk along, drops to 5, walk along, drops to 5. And you'll just do that quickly around every tooth. And again, patients that don't have necessarily a healthy mouth may have deeper pockets. And remember, we only chart what is abnormal. Especially to, let's say you only have one abnormal finding on this aspect of this carnasial, you're still going to notate the normal notations of these other 3 areas, or 3 quadrants of that tooth. And that does it for the dental